Welcome back, everyone. Today's video is going to clear up years of confusion. Because two cough syrups may look the same on the shelf, but inside, their ingredients do totally different jobs. In the next few minutes, I'll show you, in plain, simple language, which syrup opens airways, which one removes mucus, which one stops dry cough, and which one is best for allergy-related cough. Let's break this down, step by step. Before we jump into the syrups, let's understand the 5 major types of cough, because choosing the wrong syrup is 90% of the problem. Number 1, dry cough. No mucus, irritating, usually worse at night. Number 2, wet or productive cough. You can feel mucus moving. The goal is to remove it, not stop the cough. Number 3, allergic cough. Triggered by dust, pollen, pets, often itchy throat and sneezing. Number 4, chest mucus cough. Thick, sticky phlegm that feels stuck, hard to get out. Number 5, cough with wheezing or asthma history. Tight chest, difficulty breathing, whistling sound. And each cough type needs a different syrup. Let's choose the right one. Ventolin syrup. Ventolin contains Salbutamol, opens airways. Guaifenesin loosens mucus. Great for productive cough, sticky chest mucus, wheezing, allergy cough with tightness, and asthma-related cough. Not for dry cough, nighttime dry irritation, cough without mucus. Ventolin equals mucus plus wheeze combo. Hydryllin syrup. This syrup contains Aminophylline, bronchodilator, diphenhydramine, antihistamine, ammonium chloride, expectorant, and menthol, soothes the throat. Works for cough with wheeze, allergic cough with some mucus, but diphenhydramine can cause sleepiness and sometimes thicken mucus. Use carefully. Siroline syrup. It contains thiophyllin, diphenhydramine, ammonium chloride, menthol. Best for allergic cough, postnasal drip, mild mucus, allergy and wheezing. Not for very heavy mucus, severe asthma attacks, or people who can't tolerate sedating medicines. Master cough. It's like Hydrallin's twin. Aminophylline, diphenhydramine, ammonium chloride, menthol. Works for mild asthma-related cough, allergies and light mucus. Not for pure dry cough. Not ideal for elderly, drowsiness risk. Pulmonole, the king of mucus and allergy. This one is loaded in a good way. Ingredients: chlorpheniramine, antihistamine, terpene hydrate, strong expectorant, ammonium chloride, potassium guaiacol sulfonate, mucolytic, aminophylline, bronchodilator, bicarbonate and citrate, liquefy mucus, menthol. Best for thick, stubborn mucus, severe chest congestion, allergy plus mucus, difficulty clearing phlegm, repeated wet cough, mild wheezing. Not for dry cough, people sensitive to antihistamines. This is why Pulmonole is the top pick for allergic cough with mucus. Coldrex contains paracetamol, fever, dextromethorphan, cough suppressant, chlorpheniramine, allergy relief. Perfect for dry cough, flu cough, fever plus cough, viral cold. Not for mucus, wheezing, or chest congestion. Torex DM. This is your dry cough specialist. Ingredients: dextromethorphan, chlorpheniramine, diphenhydramine, ammonium chloride. Best for nighttime dry cough, irritating dry throat, allergy tickle cough. never for mucus, asthma, or chest congestion. Suppressing a mucus cough can make things worse. Now, let's discuss the purpose of common ingredients in these syrups. Bronchodilators, salbutamol, thiophyllin, aminophylline. Open airways, reduce wheeze. Expectorants, guaifenesin, ammonium chloride, terpene hydrate. Loosen mucus, make it easier to expel. Antihistamines, diphenhydramine, chlorpheniramine. Stop allergy symptoms. Cough suppressant, dextromethorphan, shuts down dry cough reflex. Menthol, soothes throat, reduces irritation. All right, time for the verdict. If you could pick only one, best for dry cough, Torex DM. Best for productive mucus cough, Ventolin. Best for allergy plus mucus, Pulmonole. These are the clearest and strongest matches. Thanks for watching. If this helped you understand cough syrups, hit like and subscribe. Comment your symptoms. I reply to everyone and guide you the best I can.